So when I think about how to assess the health impacts of air pollution, there's three components that we need to include. One is the exposure of the population. So trying to understand how much air pollution people are experiencing, either throughout their lifetime, throughout a year, or perhaps even throughout a day. And we have many different tools to do that. One would be the measurements that governments will make, air quality monitoring in our cities. But we also have many parts of the world where we don't have any measurements at all. So for that, we use other tools, for example, satellites, which also provide global coverage, but maybe not the specifics of how air pollution may vary in cities. And then we also have information about sources of air pollution, whether that's industrial sources, density of traffic, and then how does air pollution actually move throughout the environment? Are there mountains? Where's the wind direction, et cetera? And we can put all these sources of information together and get an idea of how much air pollution people are exposed to. But that's not all that we need to actually estimate the health impacts of air pollution. And so I think you're working in other areas where you're trying to make the relationships between health and this exposure.
Yeah, exactly. Once you know where people are exposed and what they are exposed to, then we will be looking for differences in exposure between people living close to busy roads, for example, people living in the outskirts of town or in rural areas, and see whether the differences in exposure to air pollution that go together with living in different places, whether they are related to the health status, the mortality of the population. And of course, there can be many differences between people living close to busy roads and people living further away. For example, in terms of smoking habits and diet and other factors. So we spend a lot of time making sure that these other factors, which could also be different between these populations, do not explain the differences in health status that we want to attribute to air pollution. And once that we are convinced that these differences are real, that there is a relationship between air pollution and health status, mortality, then we can use those relationships to estimate the population burden, the population health impact of air pollution.
And that's really where that third piece comes in, because we would also need to adjust for what the level of heart disease may be in one population compared to another population. Is that right?
That's exactly right, because if nobody dies from heart disease, then an increase in heart disease from air pollution doesn't mean anything. Of course, that's not the case. But there are differences in the disease rates between different populations, and especially if you do this across the world, you will see that the patterns of disease, the patterns of mortality can be very different between, for example, sub-Saharan Africa and Canada, where you are from. And you need to take that into account when you want to calculate the burden of disease from air pollution for different countries. So that's a very important component to make sure that you've got disease and mortality rates for different causes of death, different causes of disease. That you got those numbers right for the areas where you do the health impact assessment.
And other things would also vary, for example, the age of the population. So we know that air pollution tends to affect mostly the very young and the very old. So we'd also want to know what's the proportion of the population that's older, what's the proportion of the population that's younger, and that's also something that could vary between
That's
countries.
part of it, because we know that life expectancy varies from place to place in the world. It's maybe in the order of 50, 55 years in places in sub-Saharan Africa, and it's well over 80 in places like Japan and Singapore. So that must have an effect on the impact assessments, because as you say, air pollution tends to affect the elderly and the very young more than those in between. If you got a lot of folks in between those age extremes, then the impact is likely going to be less than when the population is very old.
And what about different air pollutants? So we have many pollutants in the air, and governments only measure a handful of these pollutants. How do we put all of this together to actually understand the impact of air pollution?
Well, that's a more difficult and challenging issue. What we now do currently is we estimate the impact of fine particles in the air, particulate matter. We estimate the impact of ozone in the air, and some organizations also estimate the impact of nitrogen dioxide, which is mostly from traffic. black carbon, which is also mostly from diesel engines and combustion processes, and some are also estimating the impact of sulfur dioxide. But that's about it, and there are many other pollutants in the atmosphere, carcinogens, irritants, that we do not know enough of in terms of what the relationship is between the concentrations on the one hand and the health effects on the other hand, to be able to estimate the health impact of those components. So it would be fair to say that we're probably, to some extent, underestimating the total impact of air pollution by not knowing enough about the more exotic components that we know are also present in the air.
And also some, depending on the pollutant or depending on the comparison, whether we're trying to do a global assessment or maybe a very local assessment, as you said, the variation in pollution may be different. So some pollutants like nitrogen dioxide might vary quite a lot over a city, but perhaps the particulate matter may vary less over the city. But globally, that may be a more appropriate measure to look at variation across the globe.
Yeah, it's glad that you point that out, Mike. As you say, nitrogen dioxide is very much related to traffic. So in any place where there is a lot of traffic, and that's true for pretty much every megacity in the world nowadays, there is contrast in exposure to nitrogen dioxide across the cities. And the levels that you see in cities across the world for nitrogen dioxide are not that dramatically different. The differences are within cities more than between cities. And this is very different for fine particles in the air, where we see very high concentrations in places like India and China. For example, because in these areas there's a lot more biomass combustion, wood smoke, on the one hand, and coal-fired power plants and coal-fired heating systems on the other hand, which have been pretty much phased out in places like Western Europe and Northern America. The dynamics of the pollution contrasts are dependent on which component you're looking at, and they're definitely very different for particulate matter on the one hand and nitrogen oxides on the other hand.
And another kind of impact assessment that we can do for air pollution is actually looking at day-to-day changes in air pollution and how that might relate to short-term effects. For example, more asthma attacks, more asthma emergency room visits, more hospitalizations. And so with that, we're actually using local monitoring data and looking at how one day may be more polluted than another day, looking at perhaps episodes if we have a particular event, and trying to take that information and estimate how much impact we may have on that day or over a course of a year in one particular city.
Yeah, I'm glad you bring that up. You mentioned the word episodes, and actually this whole field of air pollution health research was very much started and stimulated by a few major air pollution episodes. Some that come to mind are the Meuse Valley in Belgium in 1930. A lot of people died close to the city of Liège because of industrial emissions that accumulated in the Meuse Valley. The other is 1952 in London, where there was a period of about 5 days with extremely high levels of coal smoke and a tripling or 4 times higher mortality during the high pollution days. So that triggered everybody's attention and focused everyone on the short-term effects that air pollution could possibly have. And later years, starting in the 1980s or 1990s, we came to realize that the day-to-day variations on a smaller scale, so not the extremely high levels, but the day-to-day variations that we experience anyway as a result of different weather patterns, for example, that they could also be related to differences, to changes in mortality, changes in hospital admissions. And a large literature has emerged in the last 20, 30 years that actually documents that for a number of different air pollutants, you can actually see that if the air pollutants go up on a day, that on that day or the days immediately after that spike in air pollution, you see more people dying, you see more people getting to hospital with heart problems or respiratory problems. So that's another important venue of research, looking at the short-term effects of air pollution.
And there's even some cities that I've seen that have tools that will say, here's the air pollution level today, and we expect to see this many extra deaths today, and then actually accumulate this over the year. to try and show on a more continuous basis what the impact of air pollution is. So that's another communication tool that has been in use.
Yeah, and you could, at least in theory, you could use these communication tools, these expectations of high pollution levels, also to warn your population, and maybe to take measures against acute spikes in air pollution. And giving out population warnings is, for example, very relevant in places of the world which are affected by dust storms, by sand dust storms, which you cannot do very much about from occurring, but where you can at least warn your population to stay inside, to maybe wear respiratory protection in order to reduce the potential adverse health effects of those high concentrations of windblown dust.
And wildfire smoke would be another example.
Wildfire smokes, which you are more familiar with in Canada because you have forests, which we don't have too much in the Netherlands. But wildfire smoke would be another example where you can actually use the tools that you have to your availability to predict what the air pollution concentrations are going to be 1 or 2 days from now, as a communication tool to warn the population to protect themselves from those high concentrations.
Right.